I'm Roger Blumenthal, director of the Johns Hopkins Chickaroni Preventive Cardiology Center in Baltimore, Maryland. And I'm one of the co-editor-in-chiefs of the new Grunwald companion text on preventive cardiology. The text just came out at the American College of Cardiology meeting. We were inspired by Jackson 5, Michael Jackson, with his ABC simple as 1, 2, 3. So we divided the chapters into an ABC format. So we start off with things such as A for assessment of risk, and A for antiplatelet therapy, B for blood pressure control, C for all the different cholesterol abnormalities and cigarette smoking, D for diet and weight, and diabetes prevention management, and also the pre-diabetic state, metabolic syndrome, and then E for exercise and emotional health. And that's how we try to summarize all of both primary and secondary prevention of cardiovascular disease. So we'll be focusing in the book on things mainly related to atherosclerotic vascular disease, heart attacks, strokes, but also things from an epidemiologic perspective, risk factors in general, and the latest studies that pertain to how we can lower a person's risk of a heart attack and stroke. And we always have to remember that the cornerstone of preventive cardiology is better dietary and exercise habits. And we spend a lot of time on lifestyle-related aspects of cardiovascular disease. So I think practitioners and researchers can get an awful lot from our textbook.
Yeah, my name is Nathan Wong. I'm a professor and director of the Heart Disease Prevention Program at the University of California, Irvine, and I'm also the president of the American Society for Preventive Cardiology. And we're very pleased to be part of Grunwald's Preventive Cardiology. This is the premier textbook in cardiovascular disease prevention. We're pleased to have 36 chapters in the book written by experts, leading experts in the field and prevention of cardiovascular disease. Actually, we have highlighted the ABCs of prevention of cardiovascular disease throughout the entire book, and there are a number of chapters that range from anywhere from antiplatelet therapy to imaging of atherosclerosis by CT to from lipid management to actually alternative and integrative therapies for cardiovascular disease prevention. This chapter on complementary and alternative therapies discusses everything ranging from herbal therapies and nutraceuticals to actually traditional remedies that involve things such as Tai Chi and relaxation therapy. So we covered a whole gamut in complementary therapies as it relates to cardiovascular disease prevention. It's a real honor to be part of the Grunwald series, and we had a wonderful team with Roger Blumenthal, Joanne Foodie, and myself as the editors, and certainly the contributors were actually very good in coming through with their chapter. We really couldn't have done it at all without the wonderful editorial team from actually Elsevier, and they paid attention to every little detail and every little email that we sent asking them to make this correction or that correction. So we're extremely grateful to them for everything that they did.